And I think that we can all agree that our lives have been changed dramatically in the wake of COVID-19. Some of our lives have changed due to the virus itself, but many more have changed due to national efforts to slow the spread of the virus. To some of us, these efforts have felt inadequate, but to others, they've felt overly draconian. But regardless of our thoughts about these efforts, in the end, the traditional sources of human flourishing that we've long taken for granted, including our friendships, employment, civic organizations, have all been weakened, and some of them have even been eliminated. So this really is a testament to the disruptive power both of the disease itself as well as our attempts to contain it. In this panel discussion, we consider what it means to flourish, some of the notions of human flourishing that seem to be implicit in the decisions within the healthcare delivery system, public health, and broader social policy, and potentially how a more capacious understanding of human flourishing might aid our responses moving forward. So to that end, our panel will have 3 parts. First, we have short 10 to 12-minute presentations by 3 national scholars. Second, I'll pose a few questions to our panelists just to get the ball rolling, but if it seems like questions are coming in, I might even skip my own part just so everyone has an opportunity to ask some questions. And then finally, for the remainder, probably 30 to 45 minutes, we'll open the floor to questions from the audience. So again, we like this panel to be very interactive. That's one of the great benefits of Zoom rather than just going to see a YouTube video of us talking. So please do have questions ready. If you have a question, we're going to try out a different sort of approach to fielding questions. I'd like you to send me a private chat with your name and the general theme of your question. To do that, you can open the chat function in the bottom of Zoom in the toolbar, and then you can select me, Grant Martsolf, at the bottom of the chat screen. So I will select some of the questions. When I choose a question, I'll call on that person. At that point, you can unmute your mic and ask the question directly. So I want to give folks an opportunity to ask questions directly as opposed to just me mediating all the questions. So I'll ask you to say your name and your affiliation when you're asking a question. Also, this session is being recorded, so if you have colleagues that might find this interesting, we can make that available to you as well. So without further ado, I want to quickly introduce our speakers and then really get to it. So first, Tyler VanderWeele is a professor of epidemiology and the director of the Human Flourishing Project at the Harvard School of Public Health. He'll be providing us with some background about this concept of human flourishing to get us all sort of on the same footing. Kristen Collier is an assistant professor at the University of Michigan School of Medicine, where she also co-directs the program on health, spirituality, and religion. She'll be discussing some ways in which she thinks the COVID-19 pandemic has shaped the way the healthcare providers might think about the value of individual human life. And then finally, Ben Miller is the strategic officer at the Wellbeing Trust, which is a national foundation dedicated to advancing mental, social, and spiritual well-being of the nation. So he'll be discussing some potential strategies that the Wellbeing Trust will be pushing forward to help the nation recover from COVID-19, especially in terms of this broad conception of human flourishing. So with that being said, let's go ahead and welcome Tyler.
Excellent. Well, it's wonderful to be here with you all. Thank you, Grant, for organizing this panel discussion. As Grant indicated, I will be making some remarks on the concept of flourishing and what do we mean by this word. I will also give some discussion as to how we might think about different domains of flourishing, and then provide a bit of empirical data and reflection upon what has happened to societal flourishing nationwide during COVID-19. More description on the conceptualization I will be describing with regard to flourishing are in the papers on this slide, and more information can also be found on the Human Flourishing Program at Harvard website. So if we turn to our various academic disciplines, many of them often give us grand visions of what they are supposedly aiming at. The World Health Organization defines health, definition from 1948, still in place today, as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The discipline of economics is sometimes described as an attempt to study how agents maximize their expected utility, with that utility supposedly taking into account all aspects of an agent's preferences. So everything that they care about and value. The discipline of positive psychology has been defined, for example, as the scientific study of the strengths that enable individuals and communities to thrive. But in practice, if we turn to the studies that these disciplines produce, we often find very specific health or disease outcomes, or simple measures of income, or whether or not someone feels happy at the moment. So they don't quite reach this grand vision of what we might mean by flourishing. If we turn to the dictionaries we have with regard to this idea of flourishing, we find in the Oxford English Dictionary, for example, that flourishing is to grow or develop in a healthy or vigorous way. American Heritage Dictionary, to do or fare well. The etymology of the term comes from Latin florere, to bloom, blossom, or flower. The word's often used to translate Aristotle's eudaimonia, sometimes also translated as happiness. The definition that we've been using for flourishing in the work of the Human Flourishing Program is a state in which all aspects of a person's life are good. So very general, very broad, but this is arguably what we are after as individuals and ought to be after as a society, a state in which all aspects of our life are good. I tend to use flourishing and complete human well-being interchangeably. In our own work at the Human Flourishing Program at Harvard, we've often preferred the term flourishing simply because in academic circles, sometimes the word well-being is thought to indicate only psychological well-being, I think in part because of the positive psychology movement. So I tend to use flourishing and well-being interchangeably, but we'll be using flourishing here for those reasons. But the discipline of positive psychology, I think, has made important progress with regard to the assessment and thinking about subjective well-being, and especially psychological well-being, and a number of measures and assessments have been put forward, which I think have in fact advanced our knowledge of this topic considerably. But notably absent from these measures of psychological well-being are physical health. And are we really fully flourishing if we're not healthy, if we're bedridden, say? And of course, physical health has been a major concern in the decision-making around COVID-19. So I think it is critical to include physical health as a part of flourishing. It's not just psychological well-being. I'm also missing from many of these measurement approaches in the psychological literature any notion of virtue or character. Contrary to sort of Plato, Aristotle, almost all of the Western philosophical tradition, and really philosophical and religious traditions worldwide. But with a conception of flourishing so broad, we might wonder if it's ever possible really to achieve consensus, and however would we go about measuring or assessing such a thing. Certainly conceptions of flourishing are going to differ across philosophical and religious and cultural traditions. So can we ever achieve consensus?
So Tyler, this is Grant. Really quickly, it sounds like some folks are not seeing your screen share. So if you hit the share screen button. Sorry for the interruption.
No, quite all right. I apologize for that.
There we go.
Is that better?
Yes, thank you.
Okay. Well, on we go. Most of the prior material was essentially verbatim, but it might indeed be helpful to have the slides going forward. So my apologies about that. So again, how can we think about or achieve consensus around flourishing? And what I would argue is that the following 5 domains of human life are important for just about any reasonable conception of flourishing. That while a well-developed understanding of flourishing or well-being is going to vary across philosophical and religious and cultural traditions, I think any reasonable conception of flourishing would include the following 5 domains as well. Not that flourishing is reducible to these 5, but again, that any reasonable conception would include these 5 also. And those are happiness and life satisfaction, mental and physical health, meaning and purpose, character and virtue, and close social relationships. Once again, I don't think these 5 exhaust flourishing, but are arguably each a part of it. I think each of these 5 domains also satisfies the following 2 criteria. They're nearly universally desired, and we have empirical data on this. And also each constitutes its own end. It's sought for its own sake, not simply as a means to some other end. And I think these 2 criteria, being nearly universally desired and being its own end, can help shape consensus around what to measure, even within a pluralistic context like ours. We have developed, and I won't go into detail here, but a short scale to assess this, essentially taking 2 questions from the existing well-being literature in each of these 5 domains, and we have empirical validation data on this as well. Almost all the questions were drawn from the existing well-being literature on these topics, questions that had some degree of empirical validation and were in widespread use. The only exception to that were the 2 questions on virtue, which, well, great progress has been made on the assessment of character over the last couple of decades. There were very few kind of single item global measures, and so we worked with philosophers to develop 2 additional questions on character. In addition to these 5 domains, we also supplement those 10 items with 2 others on financial and material stability to sort of indicate whether the means are sufficient to try to sustain these various domains of flourishing over time. So if we want in the Q&A, I can go through kind of more of the details, but I did want to present some data very briefly on what has happened to these various domains of flourishing during the COVID-19 pandemic. So using consumer panels that are nationally representative of the United States on geographic region, gender, age, and race, ethnicity, and also made representative on educational attainment and religious self-identification via weighting. We have data from several thousand respondents, both in January, prior to the declaration of the pandemic, and in June, in the midst of it, on these various domains. Each of these are scored 0 to 10. The means in January are given in the first column and in June in the second column. And what you'll see is that it really does vary by domain, that with regard to happiness and life satisfaction, this has gone down somewhat considerably from the average of a 7 to about an average of a 6. Likewise, similar declines in physical and mental health. And the largest declines in this sample were with financial and material stability. Was the lowest to begin with, a 5.7, down to a 4.8. But far fewer changes in the meaning domain, in the character domain, and in the close social relationships domain. Close social relationships only a 6.9 to modest decline, 6.7. No change in the character domain, modest decline in the meaning and purpose domain. So overall well-being has declined. I think that is clear to everyone, but much more so with regard to happiness, physical and mental health, and financial stability than with relationships, character, and meaning. And what you'll also notice from this data is the standard deviations have all increased as well, which means the experiences are far more variable. So while social relationships has only seen a modest decline, that has varied a great deal across individuals. For some, this has probably been a time of relational growth and time to more deeply invest in family. But for others, perhaps those who are living alone, this has clearly been a time of severe hardship in this regard. So I'll just conclude by offering a few further remarks as to how this concept of flourishing is relevant in thinking about the pandemic and decisions during the pandemic. There has been considerable focus on sort of the health of the nation versus the economy and how are we to think about these trade-offs. But I would argue that the other domains are relevant as well: happiness, meaning, character, relationships. What is happening to our relationships? How are we going about finding meaning in the midst of the difficulties and the real suffering that is taking place? Are there new opportunities to grow in character through confrontation of these difficulties, of suffering, of trying to help others who may be struggling. I think there's also an interconnectedness across these domains. And so while, I think, again, a lot of the focus has been this trade-off between the economy and health, I think if we look at various aspects of flourishing, loss of employment or loneliness or mental health, depression, there's evidence from rigorous longitudinal studies that these things in fact affect and contribute to physical health and mortality. Even loneliness and depression are associated with about 30% increases in mortality, loss of employment by about a 70% increase in mortality risk over 5 to 10 years. And so I think these things also need to be taken into account in our decision making. During these times of crisis, I think focusing on trying to preserve life is often a reasonable approach. It's not the only consideration, but it's an important one. But when we do so, I think we need to likewise take into account the mortality effects of unemployment, of social isolation, of depression, on what these things will do to health and to mortality. And those effects might not be manifest immediately, but I think we will be seeing them in the months and the years ahead, and ought to be thought about carefully. Likewise, I think there may be opportunities for increased meaning, for the development of helping our neighbors, of development of character, and for investing in relationships that may have been neglected previously. So I do think we need to think carefully about each of these flourishing domains, about trying to make decisions in a way that can promote flourishing as best as possible amidst this crisis across these various aspects of well-being. Thank you.
Well, Tyler, thanks so much for that great presentation. It really tees up the rest of our time together. So as Kristen's pulling up her slides and preparing to share them, I just want to remind everyone that if you would like to ask a question, go ahead and send it to me in the chat box. You can, again, bring the chat feature up on Zoom. There's a button in the toolbar, and go ahead and send me questions. And we're going to save all the questions to the end. So Kristen, looks like Kristen is ready to go.
Okay, Grant, thanks so much. Please let me know if you don't see my slides or if the slides are not advancing. Hi, everybody. I'm Kristin Collier. Thanks so much for the opportunity to speak with you today, and greetings from Ann Arbor, Michigan. So I'm going to be speaking to you about utilitarian calculus in medicine. If I can get my slides to advance, there we go. I don't have any disclosures to tell you about today. So human flourishing to me is shorthand for what it means to be human. There is a flourishing way, a human way to honor the dead, to treat patients who are sick, to help children who are learning, and to engage those who are lonely. What I hope to show you over the next few minutes is that a utilitarian calculation, which thinks about nothing but lowering the infection rate, undermines and even ignores these aspects of human flourishing. So to get us started, I thought I'd give you an example of a conversation that I had with students around health. So as a medical doctor, I think a ton about health and how it relates to human flourishing. And so I often ask my trainees and students, what's your definition of health? And often they respond in a way that Tyler alluded to, that they'll say, health is the absence of disease. And I'll say, great, that's a good foundation to think about. Let's start there. But really, that's an impoverished view, really, of health, right? Because there's nothing in there about resilience or purpose or meaning, or really doesn't even get to really flourishing. And so I said, other examples of health that you can think of. And this one student raised her hand. I'll never forget her answer. It was so beautiful. So she was an undergraduate major in anthropology at Iowa. And part of her undergraduate research was qualitative research looking at farmers and how they viewed health. And so she said, time and time again, the farmers would tell me that they would say things like, I don't consider myself healthy until my soil is healthy and my crops are healthy and the animals are healthy and the people who work for me are healthy. And it was just such a beautiful picture of flourishing and of health that really exceeds just a biological and individual construct and really involves a communal sense of flourishing. And it really brings to mind this idea of shalom too, as we think about flourishing. And it's not just a peace, right? It's really beautiful sense of communal flourishing. I think that picture is helpful to keep in mind as we think about the role of community and relationship, especially as we think about flourishing. So I think the errors I think people make, and people I speak to when they think about flourishing, is either they reduce flourishing to a physical or a biological construct, or they focus really on individual flourishing. People think that if I just have the resources to be as autonomous and self-sufficient as possible, then I can flourish as an individual person and I can be medically healthy. That's why I think sometimes people think about flourishing to be. And Cicely Saunders, who is considered to be the mother of modern day palliative medicine, speaks against that. And she has a beautiful model that I use all the time in my teaching called the model of total pain. So you can substitute the word flourishing or suffering or wellness for pain. And she says people are completely or totally well or can suffer in 4 intersecting domains: physical, psychological, social, and spiritual. And all of these intersect. So for example, one field of science that I think speaks to this interrelation is the field of psychoneuroimmunology. So this is a field of science where they look at immune system and how the immune system is impacted and influenced by our social reality, our relationships, and our mental health. So one example of a study that was done in psychoneuroimmunology is a study that looked at women where they inflicted a physical wound. So they actually did like a punch biopsy on the backs of these women, and then they looked to see how they healed. And obviously healing is related to your immune system. And they found actually that women that had delayed healing after controlling for other factors also reported higher levels of marital discord. And to think that the cells of your body and the way that you heal, that process is impacted by your relationships and your stress is just really profound and really beautiful. And so if we come out of that sort of picture, we cannot be seen as flourishing folks unless we are in a relationship that's healthy. And from a theological perspective, I think even broadening our sense and concept of flourishing from an individual biological context to a community relationship with God in our midst also can make sense for a lot of people. And I write on a concept called theobiology, where my thesis in that writing is that because God is relational in his nature, and he is the author of all science, of which the biological sciences are a part, that we shouldn't be surprised that we are relational even down to the level of the cell. So the concept of relationship, I think, is really important when we think about human flourishing. So even if we could be autonomous individuals, which I think one thing COVID has shown us is that autonomy is totally an illusion, but even if we could be autonomous and self-sufficient, is that really the goal? And what Ben's going to talk about next is that that's not the goal, actually. US Americans have become more sort of self-sufficient and autonomous than ever, and there's never been higher levels of disenchantment and overall malaise, and that has real consequences with deaths of despair, which Ben will talk about. So when we think about utilitarianism, you know, this is recovering utilitarian. You know, when you first see the definition, right, for those of you who are unfamiliar, I think most of you are familiar, this is the view that the right action produces the most good. So first of all, do we have like 10 million years to talk about what good means? But for the concept of today, let's sort of say that this is the view that the right action saves the most lives. And as a medical doctor, I'm like, yeah, that sounds good to me. I want to save the most lives, you know? And so for a long period of time, I was like, what's wrong with that, folks, you know? But it was only with the help of my theologian friends and philosopher friends. So like, hey, this really has some weakness to it. Now I see that that's true. And this would usually take a long period of time to talk about this topic. But for the purpose of today, right, there are at a very basic level, the weakness in utilitarian calculus is that there's such a focus on the difference, like saving the most lives, right? But actually, the choices that we make upstream of that have real consequences. And as Aquinas says, what is choice worthy? So what are the other ultimate concerns and goods that we are turning away from in order to save the most lives possibly? And how do these choices that we make upstream to save the most lives, what do those choices say about what we value as a society? Because there are some that believe that the traditional Christian commitment means doing everything possible to preserve life. And in reality, preserving life at any cost is the kind of idolatry that rejects not only the example of many Christian martyrs, but the example of Jesus Christ himself. And irreplaceable actions, such as receiving last rites at the hours of one's death, or saying final goodbyes to one's children, those are totally different kinds of goods, right? So simply put, the values that trump the singular goal of, there are values that trump the singular lowering goal of lowering the COVID infection rate. And I hope to show you that more as we go forward. So one very notable utilitarian, obviously, is Dr. Ezekiel Emanuel. So many of you are familiar with him. He is a professor of bioethics, and he's an oncologist at Penn, and he was one of the architects of the Affordable Care Act. So he wrote a very sort of controversial piece in The Atlantic a few years ago saying why he hopes to die at 75, and he's a utilitarian. And he reveals his worldview in his piece, and he says that living too long is basically a loss. And he says that it's a loss because it leaves us with the inability to contribute to work, and that work has benefits to society. So if we're not able to do that, that's a loss. And basically renders us, he says, effectively pathetic, is what he says here. So, this reveals his worldview as utilitarian and how he views the human person. And I think the utilitarian calculus forces us in medicine, should force us, and as a society at large, to think about the big question of what are human beings for? How do we see the value of human beings? Where do they derive their worth? Do they have worth because they have many years left to be quote unquote productive members of society, especially in a consumerism capitalist type of model that we can somehow calculate? Or do they have inestimable worth because they are the Imago Dei, because they bear the image of God? Do they have an inviolable and inherent dignity because they are the image bearers? And not only that, but what is the goal of the human person? What is our purpose when we're here? Are we made in such a way in which we flourish actually by sacrificing and honoring God and our neighbor in a way that actually sometimes demands that we risk our own well-being and even our lives? Perhaps this is what flourishing means. So in a piece that sort of contradicts Dr. Emanuel's worldview, Gil Meilander wrote a fabulous piece in First Things in 2010, where he says, I actually want to burden my loved ones. It's a really thoughtful, beautiful piece. So in this piece, he actually sort of has, of course, the opposite worldview of Dr. Emanuel. And he says, actually, by bearing burdens, we actually flourish. And he says that families wouldn't have the significance that they do for us if they did not, in fact, give us claim upon one another. And he says in this sphere of life, in families, we don't just come together as autonomous individuals freely contracting with one another. We find ourselves thrown together and asked to share the burdens of life while learning to care for each other. And he said if we reject these claims, we cease to live in the kind of moral community that deserves to be called a family. And this piece really reminds me of, I'm sure many of you have read Alistair McIntyre's piece, Dependent Rational Animals. And he says in that piece, he argues that in order actually to achieve our own good, flourishing, as dependent, vulnerable creatures that we are, we have to participate, he says, in a network of relationships of giving and receiving. And so Dr. Emanuel wrote a piece with his colleagues that was in the New England Journal of Medicine earlier this year that says, how should we allocate resources in medicine in COVID when things are scarce, if they were to become scarce? And he says the values that should drive these decisions should be maximizing benefits, treating equally, promoting value, and giving priority to the worst off. And I read this and I'm like, great, that sounds good. Show me more about that. And so when you look at the details of how he would operationalize this based on, again, his utilitarian worldview, he says actually that maximization of benefits can be understood as saving the most individual lives and or saving the people that would likely have the longest to live ahead of them. And it's interesting that there's some wordsmithing actually that he would say giving priority to the worst off actually means giving priority to the younger people. And oftentimes when I think of the worst off in medicine, that's not who I think about, but this is what he says, because actually it'd be the biggest tragedy for them to die because they would have had this big life ahead of them, and that's the big tragedy, to have wasted that. And he says, this actually aligns with what our colleagues have done in Italy. So in Italy, you probably heard during their surge that there were stories of actually ventilators being given preferentially to younger people. And so I think, as the elderly hear us in medicine making decisions about their care, the elderly should hear in our voices and see in our actions that their lives matter just as much as those who are younger. So we can't let utilitarian calculus force us to abandon our core values of honoring our elderly. And we really need to stand above utilitarian calculus, because if we don't, what will happen is we'll get what Francis calls the throwaway culture, where people who do not have the value that we think that they should have because they don't produce or they're not part of members of society because of being disabled or being elderly, that we marginalize them and throw them away as such trash. And that's unacceptable. And another sort of legal sort of point, obviously, if people are denied ventilators or their care based on the basis of their age, that's a direct violation of their civil rights based under the Age Discrimination Act of 1975. And then what happens, right, is utilitarian calculus then drives other policies. So as you probably know, especially during the surge, the biggest part of the surge, people weren't allowed to visit their loved ones in the hospital or be attendant at their side when they were dying. And bearing witness to suffering, attending to loved ones when they're dying, honoring the dead is at the heart of what it means to be human, of what it means to flourish. And if we can't do that because of some sub-utilitarian calculation, we've lost what it means to be a human being. Saying a final goodbye to loved ones, getting last rites from a religious figure are the kinds of goods that could justify the possibility of a marginally higher infection rate. And some believe that, again, everything must be done to preserve human life, but our best theologians and philosophers have been thinking for centuries about the kinds of goods that are at least as important as preserving life. Furthermore, as we've already alluded to, the declines in education, the declines in fitness, physical fitness, the overall sort of happiness that's being lowered by our response to the pandemic will affect those on the margins worst of all. And these populations were already hit hard by loneliness and deaths of despair before the pandemic. So what will come of prolonged, like, for example, shelter in place for these vulnerable and marginalized populations? And obviously, the kind of human being and human flourishing revealed by God through Jesus Christ has nothing to do with utilitarian calculation. We are called to imitate and find his face in the least ones on the margins of the culture, period, regardless of what the math, which is really impossible to do in ethics anyway, tells us. And what we're trying to do really is put things into some tidy type of scale, which we cannot do. And so to conclude, are we going to think about flourishing in a way that honors our tenets of respect for the elderly? Are we going to think of flourishing in a communal way? Are we going to think about how we honor the elderly and have a preferential option for the poor? Or are we willing to subordinate virtually every other good for the slight chance of lowering the infection rate? So neither of the neat and clear answers, which is opening everything back up widely to try to go back to normal or continue what we're doing with a massive shutdown for everything, really is viable. The only options available involve a very difficult and imprecise weighing of options, which are often competing goods. And the weighing of this is even made more difficult, obviously, by the radical moral diversity of US culture. And the best we can do is candidly and courageously engage the issues involved and make the best prudential judgments that we can. Thank you.
Kristen, thank you so much for that presentation. We'll move on to Ben, and it looks like he has his slides shared already. And again, as a reminder, if you have any questions, point them towards me in the chat function, and we will, I will select ones to be asked live. Thank you.
Thanks, and thanks to my colleagues. The problem in going third is that you've heard just two amazing presentations, and I'd much rather have a conversation about what my colleagues just said than what I'm about to say to you. But nonetheless, I will go through my presentation here and give you what I had to say. So thanks for the opportunity to be here. I come to this discussion today ready for action. I've seen too much, experienced too much, learned the challenges that too many of us are facing around getting help, whether that be for mental health, addiction, our mortgage, our job, our families. I mean, the list goes on. We're at a critical point as a country. And while we use cliche statements like, I want to go back to the way it was before COVID, the way it was before COVID wasn't working for most of us. Flourishing was this dream, this ambition that many of us had not achieved. Deep-rooted structural inequalities, blatant racism, codified through policy, and a fragmented and antiquated view of our health make today's challenges all the more difficult. And we're in pursuit of flourishing, but it's a fight. It's one that's harder for some than others. And really, truly, it's a worthy crusade and one that I know you all are embarking on in your own way. So today, I want to talk about the things that are killing us, which I realize is a pretty horrible way to start a talk, but I think it's really essential to understand how we got to where we're at and how bad it actually is. From bad policy to social disconnection, we're dying sooner than we need to from preventable causes. And context matters here. And the context for this statement is that the US healthcare story, in large part, the story of mental health, is grounded in a series of decisions that we've created an increasingly fragmented and complicated system that costs more and gets less when compared to every other country in the world. Many decisions that have been made, legacies that we've each inherited, were at a time when these were common sense reactions aimed towards improving what I would describe as suboptimal physical and mental health care. However, the downstream unintended consequences of these decisions were pretty difficult to anticipate and yet function to further segregate the healthcare delivery system into isolated silos. That's the reality that we live with today. To give you an idea of how this is playing out and how our country is beginning to see some of these issues, in partnership with Viacom, Wellbeing Trust worked to learn more about what the American public felt was a priority. And we learned a lot. Data revealed that the one, and seemingly today at least, one thing that nearly all Americans agree on is that our lawmakers must do more to address our mental health. 91% of the survey of registered voters said that they want elected officials to focus more on mental health, with 47% going so far as to say our representatives should do much more, which is such a ridiculous majority that it makes it crystal clear that Congress is failing in its most basic duty to serve the people that they pledged to protect. We haven't seen a lot done right now, and if you just want to put it into numbers, only about $425 million has been invested into mental health through this pandemic. Imagine what could happen if 91% of our country agreed on most things. And while most of us agree that more needs to be done, the crisis is only deepening. Just a week or so ago, Mental Health America put out an update to the folks who are coming to their website for depression and anxiety screening. The numbers of people who are completing these screeners are staggering. 500% increase in people completing a screener for depression compared to previous months. A 400% increase in number of folks that are completing a screener around anxiety. And the issues, being lonely and isolated, is way ahead and in the lead, and it's no surprise. What little connectivity and community we may have had before COVID has seemingly eviscerated in a time we needed that support. It wasn't there, or at least for many of us, we haven't felt that it's been there. So when the CD puts out data showing the problem, none of us should be that surprised, except the fact that these problems have been building for almost 2 decades, longer perhaps, if you want to go beyond the data that are in front of you. These, my friends, are what Kristen alluded to and what we have called the deaths of despair, what the literature calls the deaths of despair. These are deaths to drug, alcohol, and suicide, and they've been increasing since we started collecting the data at the CDC in 1999. They're driven by factors that go far beyond health. They're driven by things like social, economic factors, by deeper issues like pain, and not just the typical way of looking at pain like tissue and nerves, driven by emotional pain. And to show you how bad this is really getting, nearly 72,000 Americans died from drug overdose last year, and that's according to the preliminary data that the CDC released just a few weeks ago. This is an increase of 5% from 2018. Deaths from drug overdose remain higher than the peak yearly death totals ever recorded from car accidents, guns, or AIDS. And we could look at them as a major contributor to the decrease in life expectancy in the United States. And early data from this year, as many of you saw in the first 4 months, have already shown a 17% increase in drug overdose from last year. Wellbeing Trust, in collaboration with Kaiser Family Foundation, recently released state fact sheets, which highlight key data around mental health and substance use needs and capacity. And just to give you a little bit more context, we broke this down by state. The goal here, because the issues are increasingly significant during COVID, with around 36% of folks in the US, depending on your survey that you read, this is from the KFF survey, showing symptoms of anxiety and depression, which is up a whopping 25% from the same time last year. We wanted to create the ability for people to move towards solutions. And one of the best ways to do that was to let people know a little bit more about their states and what was happening. To really spur us into more action and do something around this of despair, we've been very out in front talking about these issues to anyone that'll listen, from op-eds to predictive analyses that have shown how many more deaths of despair might occur from COVID. And as you can imagine, it's a lot. It's more than we should have. And it's in part based on social factors and economic recovery. And as we all have seen from the data, our recovery economically is not growing as quickly as we thought, but it's the jobs. A lot of the jobs that are coming back are not as robust as we would hope. And so we still have 10 million people in this country that are unemployed. That is a major risk factor and contributor to deaths of despair. We've even taken these data and put them into county level briefs to really encourage lawmakers to do more. This is one in particular from California, from Napa. And we did this as a way to let lawmakers know that if there's not action being taken on issues around deaths of despair, then unfortunately we could see much worse outcomes than we have before COVID. So we're in pain and our nations need solutions. Even before the COVID-19 crisis, it was apparent that America's infrastructure for mental health and addiction services was too fragmented, too overburdened, and way underfunded. The coronavirus has put far more stress on that broken system. And so far, as I've already mentioned, Congress has failed to really shore it up. That oversight will prove harmful to patients and their families and costly to insurers and taxpayers. So what we did is we created a Healing the Nation guide, which aims to offer up concrete recommendations for Congress in mental health. And we ground this approach, our policy work, in a framework. It's what we call a framework for excellence, because when healthy community conditions, good coverage, and inclusive policies all come together and are in place, we can achieve positive outcomes that improve the overall mental health and well-being of Americans. Accomplishing this goal, however, requires a framework that sees mental health as existing on a continuum that begins in community and extends into healthcare. We begin to decouple illness from health, as you've heard from my colleagues. If we are serious about tackling issues of mental health and addiction in our country, we must leverage all the places that people show up. We also must see needs as including risk factors as well as mental health conditions, and focus on the upstream factors that can prevent or mitigate later problems. As you can see here on the slide, one of the biggest things that we are looking to do is to bring mental health services, whatever that might look like, into the places that people show up, including their schools, their pediatric practices, the criminal justice system, and so on. But we must be brave and we must think big. On the slide in front of you, you can see examples of what bigger thinking might be. And it will be no surprise to many of you that if we do not go back and reassess some of the structural flaws that are inherent within our system, no matter how much money we throw at it, it's not going to change much. You can put as much money as you want into a broken system and it's still going to get the same outcomes. And so how do we allow for us to really use this time of reflection to look back at what wasn't working, to consider things that might work within a new structure? We must also apply new methods to our work, to push beyond what's been tried and to leverage learnings from other social movements. You can see here on the front, in the slide in front of you, that there are elements, key elements that go along with social movements. So what we wanted to try and do was to apply these to advancing mental health. For example, we know that you have to have policy muscle as one of the main elements to drive a social movement. So Wellbeing Trust, alongside others, invested in the curation and creation of Inseparable, which is a new 501c3/c4 that gives the movement a bit more of that policy muscle that it was lacking. And you can go to the website inseparable.us and you can see more of the things that they're working at. Inseparable has been able to come into communities, come into states, and come into our government and push in ways that myself, as an organization who is a 501c3, can't do. We've also invested in a group called Mindful Philanthropy to give the movement more of a financial engine to keep it moving. What happens when you create and allow for folks to see the opportunities for their own investments? There's a substantial amount of folks out there who want to give to the cause, who want to invest in mental health, but they don't know what is going to have the most impact, the bang for the buck. Organizations like Mindful Philanthropy can help not only direct people, but organize us in a way that we can keep that financial movement or financial engine going for the field. So in closing, this is a moment for change for mental health in our nation. If we want to embrace flourishing, I believe it's going to require at least three things at once right now. Now, I'm oversimplifying, and it's a long discussion. But number one, we need to have leadership at all levels address this issue and not leave it ignored. Unfortunately, we haven't seen issues around mental health being discussed, especially right now during COVID. It has to have leadership. We have to have people speaking into this. Number two, we've got to embrace the fact that mental health is foundational to our health and found deeply in our communities. Let's bring it into our homes, into our testing sites for COVID, into our schools. Let's create a different type of system that prioritizing showing up where people are. Colleagues and I just recently published an op-ed that was looking at, when we do ultimately one day, sometime, whenever, get a vaccine, when we have point of dispensing sites where people are driving through tents getting vaccinated, isn't that a good time to check in and see how people are really doing? When we have contact tracers that are out there following up with folks who have been exposed, isn't that a good time to ask them how they're doing? All of these things are really simple, but they take us back into this this place where community is taking responsibility for some of these issues that we have given up to healthcare. And third, let's finally invest. Let's invest in people. Let's invest in communities. Let's lift up the local solutions that will be the backbone of our successes. Let's not shy away from the creative ingenuity that allows for flourishing, a creative ingenuity to solve complex problems, a creative ingenuity that lies at the heart of America's soul. For us to embrace mental health and to fight back the deaths of despair, it's going to take a new approach to health. Thank you. I look forward to our discussion.
Well, thank you, everyone. Thank you, Ben. Thank you, Tyler and Kristen, for those great presentations. Just a quick point of order. It turns out that you're not able to chat with me directly. We're not quite sure what's going on with the chat, but there's another function at the bottom of the toolbar called Q&A. So if you would like to ask a question, you put it in there and I will select some. And hopefully those questions will start coming through. But in the meantime, I thought maybe I would get the ball rolling. It sounds like Ben had some questions for the other panelists too. But one thing that Kristen's presentation brought up, it reminded me of an article I read this week by a philosopher named Ralph Coons at the University of Texas. And he sort of argued that there seemed to be two prominent approaches to public reason in the time of COVID. One he called the sentimentalist position, which argues in short that saving even one COVID death was worth any cost. You might remember the press conference with Governor Andrew Cuomo, where he literally said that if we can prevent one COVID death, it's worth any cost. And the second is a sort of calcularist approach. We sort of establish how much money one death is worth, and that's sort of what we should spend in terms of economic disruption. So then sort of the COVID response can be sort of simple math. So I guess the question for the panel is, to what extent do you think these two approaches to public reason are operative or have been operative in public decision making? Is there any approach to public reason that might be more useful? Are we using something else? And I noticed that Kristen brought up the word prudence. And I'm wondering what role that might play in the way that we think about these decisions. And I'll leave that open to any of the panelists that want to respond. Make sure to unmute yourself. You're currently muted.
I'm happy to offer a few initial reflections on the topic. I mean, I do think both approaches are highly problematic with regard to the calculus response. I mean, I don't think one can put a value on a life, and I think trying to do so is deeply morally problematic. On the other hand, I don't think we can say we're going to do whatever we can in all circumstances to save one life, because there are other lives at stake as well, and resources are limited. And I think one of the real difficulties that the pandemic has presented us is that we're effectively trying to weigh and balance incommensurable goods. These things do not have an equivalence to one another. How do we weigh relationships and meaning and physical health? There is no calculus to it. And so it's trying to preserve as many of these goods as possible. I do think most of the goods we've been discussing, most of these domains of human flourishing, do require life. And so I think trying to preserve life is a good thing. And I think especially when we had a great deal of uncertainty and we weren't very confident with regard to what infection mortality rates were like, it was good to be cautious. But as knowledge expands, and as we realize the infection mortality rate is not especially high, it's still important. We've seen 200,000 deaths in this country, but I think we can begin to do a better job of weighing these goods. And because many of these goods also have effects on life itself going forward, I mean, I think that can in some ways be used as a baseline for trying to put together arguments that can appeal to those who may have different perspectives. So if it's clear that by preserving employment we will in fact save more lives, then by one policy versus another, then I think it should be clear to everyone, even those who have emphasized the potential mortality cost of infection, that we should be pursuing that policy. I wouldn't want to reduce employment and jobs just to its effects on mortality, but that can be one way to, I think, try to produce arguments that may have more universal appeal, even though we may value these goods differently.
One of the problems of putting out a report during a pandemic that says that more people might die from deaths of despair is that it gets misconstrued and used by everyone under the sun for their particular political cause. From the White House on down, we had a report cited, and most of the time they hadn't read the report. And so they actually didn't see in the report that we said we should not use these data as an opportunity to prematurely open up the country without being prepared for what it means to actually open up the country. It's Public Health 101. And I think to Tyler's point, this is something that is extremely problematic to me, is that when we default to a position of using the issues that we seemingly didn't care about to now care about to serve our own purpose, we've really, we've taken ourselves backwards, I think, in doing what really matters for communities. Mental health has been marginalized for far too long. And when we simply use it as a convenient talking point, it unfortunately becomes something that gets politicized. It becomes that new political football that's tossed back and forth. So I think that this is a both and. And I tried to say that in my remarks just briefly, but let's be smart and let's be calculated with how we do open up the country. Let's consider that even by opening up the country now and having our kids back in school, I'll look at my own children as an example, they are having different types of social interactions that is not just going to go away when there's a vaccine. The psychological ripples in the water from kids wearing masks around each other and feeling like they have to wash their hands every 5 minutes isn't just going to go away because mom and dad now say you got a vaccine. This is something that if we don't embrace and truly approach from a more comprehensive perspective, then there'll be a webinar like this 25 years from now saying what we got wrong.
Just to piggyback on some of the comments here, I mean, that piece in First Things was really great. I highly recommend it for anyone who's interested in thinking about this issue deeply. I mean, I think the fundamentalist view, I think, you can't follow it out all the way. It eventually breaks down. And if you sort of stick with it to the end, you find yourself, as I mentioned, with a type of idolatry, honestly, where you start to subvert other ultimate concerns for the sole sake of preserving life at all costs, which I think I displayed as problematic for many reasons. One way specifically, which I see sort of the calculus sort of sometimes worldview playing a part in policy, which I didn't get to talk about today a ton, was in QALYs, which I think is worthy of bringing up. So QALYs are quality adjusted life years. And so you'll see this metric used sometimes in policy research where they'll put a value in some type of intervention by saying how many QALYs that it produces. And so where there's like a monetary unit placed on a year of life that's lived in what someone says is like good health, which is usually, again, very subjective. So what that says to people who are not able-bodied or who are disabled is basically the QALYs is how they're used, basically, and policies that use them say that your life as a disabled person is not worth as much as someone who is able-bodied. So QALYs are ableist, and they're still used and quoted. And, as I just want to point out in that discussion is that it was Charlie Camosi who taught me that, doctors are incredibly ableist in the way we think about things. And the research shows actually that doctors will rate disabled persons' quality of life much lower than disabled person themselves rates their own quality of life, often because doctors are very historically, in order to get through traditional medical education, have had to be, because of the function of the training, very able-bodied, come from a point of privilege, and oftentimes consider people who are not able-bodied to not have a very good quality of life. And if you ask people themselves, they say actually my quality of life is quite good. So I think one specific way we can sort of call out this utilitarian calculus is by calling out QALYs for what they are, which are basically ableist.
Thank you. I'm starting to get some questions in from the audience. So I'd like to invite Tiffany Pelethy to ask a question. If you unmute yourself, you can go ahead and ask. I know Tiffany is a graduate student here at the University of Pittsburgh and maybe a postdoc at this point.
Can you hear me?
Yes.
Okay. Yeah, so first of all, I just want to thank everybody on the panel that's spoken. It's just been a delightful, really wonderful to hear. And I have to say, my background is in nursing, critical care nursing, and I'd never even actually heard of the concept of human flourishing until Dr. Martsolf was speaking about it earlier this year. And I've been really looking into it. So I guess my big question is, Dr. Miller, you spoke about structural flaws in our systems and the need to work together. And in this panel, there's experts in nursing and medicine, psychology, social science, and more. And I'm just wondering, how do you all as experts envision concrete steps for making our system structures less siloed and for integrating teams like are here today, working together on moving these issues forward? Because I think it's just inherent in disciplines to think about flourishing or to think about wellness just in that little microcosm that you are trained or educated in. As a healthcare professional, I'll admit that. So I'm certainly learning, but I'm just kind of wondering what you think would be some concrete steps for integrating more experts working together from different backgrounds to solve these kinds of problems like we're doing here today. Thank you.
Thank you for your question. I'll start off with just a quick remark. I think that unfortunately in our professional training, we come to know each other way too late in life. There's opportunities to sit in the same classrooms and to study from the same textbooks that would really benefit us just socializing to one another much earlier in our own process. And we just don't do that. I remember 15 plus years ago hearing about a medical school in Puerto Rico that trained its physicians alongside its psychologists. Throughout medical school, graduate school, they took the same courses until they didn't. And when they didn't, and they went and specialized in whatever they were specializing on, they came back together for their clinicals. They came back together for their practicum experiences, their internships and the like. I think that if we're going to change the culture of what's expected in delivery, we've got to be much more familiar with one another earlier on in our training process. And that's just simply not been valued to date. And I think my colleagues, we can all speak to this from academic perspectives and our own training experiences. But to me, if there's one thing that we could do that would really help facilitate that, it's probably just starting earlier within our process of socializing to each other.
I love that. That's a great idea. Thank you.
Yeah, so one thing I've been thinking a lot about, and this is one of the reasons why I'm so interested in working with the Beatrice Institute, is, as an undergraduate, I have a joint degree in business and nursing. It took about one elective in my entire college experience. And so a lot of the stuff around human flourishing and human personhood, I've had to kind of learn on the fly. And I think in many ways, we've created our clinical education to be so technical that I wonder if we might want to back up and do a better job of sort of helping us understand these questions, these essential questions of what is a person and what is the state and what is the state supposed to do. So I'm trying to really encourage my own students to really read broadly. And I think it would be interesting to read with folks from other disciplines.
Yeah, I think just to sort of piggyback on that a bit too. I mean, I think all the time about traditional medical education and how there's so much science to learn, right? But what happens is you come out of that with really a bio-reductionist view of what human life is. That life is basically just molecules in motion, and you come out of it thinking that you're a doctor and you're just a technician. And we are not technicians taking care of complex machines. We're taking care of the image bearers. Like, we are taking care of human persons who have, again, inestimable worth. And just like Grant, I got a really late start on this. I grew up in a very sort of traditional sort of scientific lens of all my education. And just now I'm getting caught up, right, on sort of these big questions, being able to think about, thank goodness, I've been doing some work over the past couple of years with Notre Dame. It's only honestly by hanging out with some theologians and some philosophers that at 45, I'm starting to think about questions about human dignity and flourishing and what human beings are for. And sometimes people are like, why are you thinking about that? I'm like, my goodness, like, as a physician, like these are things I should be thinking about. If I'm not thinking about why human beings have worth and the dignity of the human person, what am I even doing in my job? So I think that, again, this does hopefully start early by encouraging our undergraduates to pursue fields of study that aren't science. A third now of our medical students actually have had an undergraduate major that was not science-based, and I think that's wonderful. And I think in terms of Tiffany's question about sort of the teams, yeah, I mean, interprofessional and multidisciplinary are all the buzzword now, thank goodness. But thinking about even structuring our teams, as you mentioned, Tiffany, work in ICU care, thinking about our ICU teams being interprofessional. So yes, we have the ICU teams with the medical doctors who are probably using their expertise mostly for the medical biological aspects of disease, but also having chaplains on our teams to be able to round, and social work. And do we have the patient perspective? Are we rounding at the bedside for the family's perspective to try to get the fuller picture of the person's suffering so we can be attendant to all those aspects?
So I'd like to make a couple of comments going back to Tiffany's question from a public health perspective. I think Ben and Kristen can comment much more adequately with regard to what needs to change with regard to the healthcare system. But in public health, we focus on prevention. How do we structure society so that healthcare isn't even needed as often? How do we prevent these mental health troubles from arising in the first place? And I'd like to offer 3 ideas in that regard. First, I think we need to change what metrics we're using in evaluating ourselves as a society. I think so long as GDP per capita is our chief measure, we are going to not do as well on these other flourishing outcomes, including mental health, but also relationships and having a sense of meaning and purpose in life. So I think that needs to change. It needs to change at a governmental level, but also as individuals and making career choices. What is it that you are trying to maximize? So again, what is the end? And how are we measuring it? Second, I think in terms of some of the mental health difficulties, I think we've become increasingly divided as a nation. And I think we need to reflect on, how can we together seek the common good? How can we seek what's good even for those who disagree with us, even for those who are opposed to us? What is the role of the media and of social media in this phenomena of increasing tension and disagreement and polarization? And I think until that's addressed, we'll likely continue to see increasing mental health difficulties. And then thirdly, I think, and this is a challenge during COVID-19, but the role of community. Strong evidence that participation in communities really is protective for mental health and conducive to flourishing. A lot of my own work has been on the role of religious community. One of our most recent studies found a 2/3 reduction in deaths of despair for women attending religious services on a weekly basis, and a 1/3 reduction in deaths of despair for men attending religious services on a weekly basis. And what one finds similar, though smaller, effects for other forms of community life. But I do think we need to come back to this question of how do we build, and Kristen touched upon this in her talk, not just sort of flourishing individuals, but flourishing communities, and commit to those and to invest in those.
Great. So we also have a question that was just posed by Ryan McDermott, who I know is a professor here at the University of Pittsburgh in the English department. So Ryan, do you want to do your question? Let me very quickly, there you are. So unmute yourself. There you go.
Yeah, thanks for all this fascinating data. A lot of it points to a sharp decline in measures of flourishing and well-being during COVID time. I'd just be interested to hear if there are ways of comparing those declines to other upheavals in social and economic and medical life. So like when you compare these adverse effects from COVID and lockdown, what does that look like compared to other kinds of adverse effects that we've seen around the world and in history?
So Ryan, it's a beautiful question, and one that's a little hard to answer. And just if I'm going to be honest with you, We can look at other traumatic experiences. You can look at rates of mental illness rising after 9/11, for example. You can look even at pre-post with COVID at rates of depression and anxiety. What makes this one a kicker, and what we tried to study in our report, is that you can look at the other times in the nation when we've had economic decline, unemployment rise, and you can look at the rise of suicide, drug overdose, et cetera. And you can look at that as a relative comparator. What you can't do, though, is you can't mimic what's happened right in the last several 8 to 9 months around the social isolation. I mean, I don't think anybody in their lifetime has lived through a public health crisis of this magnitude and been so socially disconnected. So that's the one variable that I think is harder to put your finger on and quantify. It doesn't mean you can't quantify because, you know, as the literature would show us, prior to COVID, we were still seeing rates of individuals identifying as lonely much higher than we have in the past. And so what COVID has come and done is it's put a magnifying glass on some of those issues for many of us and exacerbated, I think, in ways that we're going to be studying for the foreseeable future. So if you just look at the economic factors, the answer is yes. This is about, well, we won't know for a little while because we're still getting data, but it looks like it's comparable to other economic declines like 2008 for the Great Recession. But what we can't factor in is how those social issues around loneliness, isolation, and being disconnected are really going to play a role. So it's a beautiful question. Maybe my colleagues have a better answer.
I can just offer, you know, one more point for reflection, which is, you know, compared to the 2008 financial crisis, I think what's very different here is the unemployment, which is just dramatically larger, and there's sort of evidence that actually suggests in most cases recession will often lower mortality rates. But that's general economic decline. That's not unemployment. Unemployment, I think, really has negative effects long-term on physical health and on mental health. And I think we're going to be seeing this in the months and the years ahead. So, you know, the stock market's exceedingly high right now. So you know, what's happening to the economy is very different than what's happening to individuals. And I think we've not adequately wrestled with what the long-term implications of unemployment for so many people are going to be. And that's very different than it was, much higher rates of unemployment than 2008.
Thanks, Ryan, for the great question. We also had a question posed by Sarah DeWood, who's another graduate student here at the University of Pittsburgh in the bioethics department. So Sarah, do you want to go ahead and bring yourself up and ask your question?
Can you hear me now?
Yep.
Okay, cool. So Dr. VanderWeele, you assert that there are these aspects of human flourishing which are universal. However, it seems that we as a society are failing to recognize them and act in accordance with this recognition. So why do you think this is the case? Why are these aspects of human flourishing so difficult to recognize, and why are we as a society failing to recognize them?
I think that's a very good question, and you know, one worth pondering at length. And I do think in people's individual lives they care about these things, and sometimes it in fact takes a crisis to realize how much they care about these things, how important a particular relationship is, or what really am I seeking in life? What is my purpose? Or in spite of these horrible circumstances, how do I still try to be, you know, a good person? You know, I think often in our day-to-day life, we just get caught up with what is taken at a societal level as what seems to be the central goal, the primary pursuit. And I think we are living in a highly materialistic context now. And, you know, from having GDP as the chief measure for societal progress to, you know, portrayals of luxury in movies and media and advertising, to when, discussing and thinking about jobs and career and vocation, focusing on what my income is going to be as kind of the primary measure of success. So long as these are being continually presented at the societal level and within our culture as the primary goals and ends of human life, I think it's what, as social creatures, we will often naturally seek, and often it does take, a crisis, either individually or societally, for that to be altered. In terms of kind of what small intermediate steps might be, I do firmly believe that what we measure shapes what we think about, what we talk about, what we aim for, and policies put into place to achieve that. And so I think, if we begin to measure not just income and physical health, but also what are the levels of loneliness in society, to what extent do people feel they have a sense of meaning and purpose, I think we'll start caring about these things more, reflecting on these things more. When we've used these simple flourishing measures in sort of workplace settings, we often get responses along the lines of, this has been so helpful for me to just take a quick look at my own life and figure out where I need to and want to improve. So I do think the simple act of measurement, in fact, might help in some small way to bring our minds back to these other aspects of flourishing, which I do think we genuinely care about, but sometimes need some encouragement to realize that.
Yeah, so Sarah, that's a great question. One thing that I might add, one thing I've been thinking a lot about this week is, in the United States, we are very allergic to a common conception of the good, right? Like the good is very much left to the individual to sort of self-create. And a lot of these things that go into human flourishing, like meaning and love and character, are intrinsically tied to some sort of broader transcendent good that makes us very squeamish, and we get very wary but we can kind of agree that we need food and we need shelter and we need clothing. But once we move beyond that, then we get into these questions of the eternal good, and that makes us as Americans very nervous. I think that probably has something to do. I don't have a good answer to what that would look like, of how we can reason together about what might be broader goods that we can agree on that go beyond sort of the ensuring access to sort of individuated private material goods.
So I'd like to push back a little bit on that, Grant. And,
yeah, please.
And sort of say, I do think those 5 domains of human life that were put forward, while not completely exhaustively capturing flourishing, and while admittedly neglecting spiritual goods, which many people consider central and which are going to vary across religious traditions. I think those 5 domains of human life are nearly universally sought. Kind of what brings meaning to people may differ, but everyone wants it.
Sure.
So everyone wants to be happy. Everyone wants good relationships. And so I do think there is, in fact, more room for consensus than is often granted, even on that character domain. I mean, when I talk about character, I often do get some pushback.
Right.
Surely this is, culturally specific, and how could we ever come to agreement on this? But I think if you look across cultural and philosophical and religious traditions, there's not universal, but I would say near universal consensus that this is an important part of life. Almost everyone, not everyone, but almost everyone wants to be a good person. So we can have agreement that character is important. I think we can even have a fair bit of agreement on what some of those virtues are. I mean, if you ask something like practical wisdom, and you say, who wants, let's see a show of hands, who wants to be foolish? How many would take that up? Or courage, who amongst you wants to be cowardly?
Right.
Or justice, who amongst you wants to be unjust? You're just not going to have many takers. So we can agree on character, we can agree on some of the virtues. How precisely those are understood, there will be nuances. But now we're kind of at a third order level of disagreement.
Right.
And even there we can probably find some consensus. So I do think we need to work as a society to find where we can come to an agreement on other goods beyond simply economic and
yeah. And I think that's good. I think that what you're describing is sort of similar to the process that got us to the Universal Declaration of Human Rights in the 1940s, where they sort of put we sort of agreed on what those rights were, irregardless of the philosophical or theological justifications that got us there. Now, that's a hard consensus to maintain in the face of pressure, but I think that I agree. I think that we could do something like that that brings us to, to your point that how as a people do we promote courage or prudence? I think that's a very useful question. I think we can get pretty far to your point. So one other question that I am seeing that was brought up, and I think that this is an interesting one, a little, it's not directly related to the material, but someone did ask, are there other forums where people are having these conversations? I'm hearing from a lot of people that this is a very refreshing conversation and they don't hear it very often, and wondering if there's conferences or other forums in which people do have these kind of conversations as an academic.
One conference that I just absolutely love, I'm sort of a conference junkie, I used to be a conference junkie before COVID. And it's the one conference I would say, of all the conferences I would say, no, I don't want to miss. It's my favorite conference. It's the conference actually at Notre Dame of the Nicola Center for Culture and Ethics. And it's their annual fall conference on culture and ethics. And it's just so beautiful. I mean, the conversations and the papers that you hear there about what it means to be a human person and flourishing and the intersection of these topics with theology and medicine and law. It's a really beautiful, soul enriching type of conference. So I would highly recommend it. This fall, it's been canceled because of COVID, but in future years, when it gets resurrected, I highly recommend that conference. The other sort of platform where I see a lot of discussion on this topic is actually Twitter. I'm sort of newer to the Twitter world over the past couple of years. There's been a wonderful, rich conversation that I've seen amongst theologians and philosophers and physicians that come together in this platform that sort of flattens the hierarchies for everyone to sort of contribute. Actually, I've had some really great sort of conversations and eye-opening sort of time on that website or on that site to be able to think about these topics more deeply. One person that I would sort of consider following who does a lot of work in this space is Professor Camosi, who's a moral theologian out of Fordham. He had a beautiful thread today actually relates to this topic about how we're viewing the elderly in this country and the choices that we're making that are putting them at risk actually.
A few other ideas that touch at least on some aspects of what we've discussed. Certainly the positive psychology conferences touch on some of these issues. There's also a conference held every year at Oxford by the Jubilee Center on character and virtue, where a number of these sorts of questions are discussed. The conference on medicine and religion touches on a number of these topics as well. The Human Flourishing program here at Harvard, we do try to host a conference annually on some specific topic. So we've done meaning in life, we've done religious community, we'll be doing one on forgiveness. So in any case, those are a few other ideas.
One question that I did have, we're sort of hitting the end of our time, but one type of public gathering that has been a special focus of the response has been religious gatherings. Particularly in Allegheny County, many religious organizations are exempted from the large gathering rule, but churches have also become not a target is not the right word. People have highlighted the role of churches in the transmission of the virus. So there's many institutions, not just churches, but other things like youth athletics and schools, this is very relevant right now, that are integral to human flourishing, but they, to some degree, require in-person contact. What do you think is the proper posture of these sorts of institutions as we sort of move forward in COVID? What's the proper posture, knowing that they contribute so much to human flourishing, but at the same time are also a potential vector for passing the virus back and forth?
I can't speak very academically on this one, but I can speak from a personal experience living here in the South and having two parents that serve as deacons in their church, and the discussions that go on in our family dinner table around should churches open or not. And what we've been discussing is the role of that communal worship, the function of that within many of these faith communities, and how you do lose that function, but you still retain the ability to learn from one another, even though it's a little bit different. You still have the ability to have messages that come your way. But what I said to them, which I don't think this is where my colleagues can make it sound a whole lot smarter, is I said, like healthcare, it's also an opportunity to examine structure and to think about the things that were really working. If part of the faith community's mission is to serve or to be present with communities that have need, then, you know, this is, from my perspective, where the faith communities can really step up and have a different type of dialogue on what's happening around race in America, or have a different type of dialogue around why people are dying from drug overdose deaths and we're not doing anything about it. It's not the moral failing, it's that we've failed as a society to embrace people in pain. And I think that's a conversation that should happen in any of our houses of worship. And people think that it's as my parents have said, you know, well, that's a political thing. We don't want to get political, but it's not a political thing. So I don't know if that's an answer or a non-answer, but if I were the only one on this panel, that's what I would have said. My colleagues could probably say something better.
I certainly agree with what Ben said. I do think churches have, and other religious communities in this country and worldwide have that important role to help, to serve the broader community, to sort of encourage love of neighbor, to encourage reconciliation. And I think I do think these religious communities are very important in that regard. I think they're also important in encouraging and promoting these other aspects of flourishing, you know, from our studies, contributions of the weekly service attendance to physical health and longevity, to lower depression rates, lower suicide rates, to greater sense of meaning, to closer relationships. So I do think these religious communities contribute a great deal to flourishing. I mean, I think they should be opened before bars or movie theaters, for example. But I do also think they have a responsibility to open in a way that's careful and reasonable and sensible. I mean, I think masks should be used. I think social distancing should be in place. You know, if the community can do so, I think they should have multiple meetings, which are much smaller, because they can likewise, as you indicated, Grant, be a source of transmission. And so I think there's a certain responsibility out of love for neighbor to, when the pandemic's particularly extreme, you know, to cease meeting. A lot of the discussion has been around rights, but I think it should be reframed around what is the responsibilities of these churches and other religious communities themselves. And you know, many have found online forums to do this, and I think those only partially contribute to the goods that these religious communities do otherwise. But you know, I think, like schools, religious communities as well should be prioritized, but need to do so in a sensible, cautious manner. And there are circumstances under which I think the responsible thing to do is, for a time at least, to cease in-person meetings.
Well, I do know for our family that starting school has been exceptional for my children's flourishing. So we're grateful for that. But into the point too, you know, with proper protocols and proper masking and social distancing, you can both have the benefit of those aspects of those institutions that are so life-giving, at the same time, as much as possible, reduce transmission, which is a bit of a truism, but it is true. So we have about 3 minutes left. I don't see any more questions coming through. So I did want to take a quick second to thank our panelists. This was a really great conversation. I'm very, very grateful that all of you took the time to join us on the call today. And given what I'm getting privately, it seems like folks on the call also found this to be a really great time together. So I do want to say that if these questions are ones that interest you, and you're in the Pittsburgh area, you please connect with the Beatrice Institute. We have a website. It's beatriceinstitute.org. You can sign up for a mailing list. And then, as I said, on the invitation, we've listed all of our co-sponsors, and a lot of the sponsors of this event are very interested in the kinds of questions that we're asking today, which I think are obviously very, very important as we move forward as a nation and as colleagues. So thank you so much for your time, and I hope you have a great afternoon.